What's up, future nurses and seasoned pros? Welcome back to the channel. Today, we're re-diving into a crucial skill ULL use all the time, drawing blood from a PICC line. It might seem a little intimidating at first, but trust me, with the right steps, you'll be doing it like a pro in no time. So, what exactly is a PICC line? PICC stands for Peripherally Inserted Central Catheter. It's a long, super flexible tube that's inserted into a vein in the arm, with the tip extending all the way up to the superior vena cava, a large vein right near the heart. It's a game changer for patients who need long-term treatments like antibiotics, chemotherapy, or TPS. And the best part, we can also use it for blood draws, which saves the patient from getting stuck with a needle over and over again. Before you even think about touching the patient, let's get our setup right. This is your mission-critical prep phase. You'll need sterile gloves, alcohol or chlorhexidine swabs for disinfection, and a few 10 milliliters pre-filled saline syringes. You'll also need an empty syringe, which we'll use for a discard sample. Explain why in a bit. Grab your blood collection tubes or a vacutainer setup, some sterile gauze, your specimen labels, and a biohazard waste container. Always, and I mean always, check your facility's specific policy first. Things can vary slightly from place to place. Now for the pre-procedure checklist. First, wash your hands. Hand hygiene is non-negotiable. Next, verify your patient's identity using 2 identifiers. Confirm the doctor's orders for the blood draw. Then, you need to check the PICC line itself. Does it flush easily? Can you get blood return or aspirate? If not, stop right there. You might have a problem that needs to be addressed before you can proceed. Alright, let's get to the main event. The procedure itself. First, pause any infusions that are running through the PICC line. This is super important to make sure you're not drawing up medication instead of pure blood. Now, put on your sterile gloves. Take an alcohol or chlorhexidine swab and scrub the hub that's the connection point on the catheter for at least 15 seconds. Let it air dry completely. Don't wave it, don't blow on it, just let it dry. This step is key for preventing infection. Next, take one of your saline syringes and gently flush the line. This confirms it's patent and ready to go. Now, attach your empty syringe and withdraw about 5 to 10 milliliters of blood. This is your discard sample. We do this to clear out any saline or medication that might be lingering in the line, which could mess up your lab results. You'll dispose of this sample according to your facility's protocol. Now it's time for the real deal. Attach a new syringe or your vacutainer and collect the blood samples you need. Make sure you follow the correct order of draw for the different colored tubes to prevent cross-contamination of additives. Once you have all your samples, detach the collection device. We're almost done. Take another saline syringe. This is your final flush and flush the line with 10 to 20 milliliters of saline using a push-pause technique. This clears the line of any remaining blood and helps prevent clots, keeping it patent for future use. Once flushed, you can restart any infusions that you paused earlier and make sure the line is securely clamped and capped. But don't walk away yet. The final steps are just as important. Label all your blood samples right there at the bedside with the patient's information. Never pre-label tubes and never label them away from the patient. Then document everything in the patient's chart. The time, the volume of blood drawn, which lumen you used, and how the patient tolerated the procedure. A few quick safety tips to burn into your brain. Always use a syringe that's 10 milliliters or larger. A smaller syringe can create too much pressure and damage the catheter. Never ever force a flush if you feel resistance. Stop immediately and troubleshoot. Always maintain a aseptic technique to prevent infection. If you see any redness, swelling, or the patient reports pain, stop and report it. And of course, dispose of all your sharps in the proper container. So let's recap the key steps. Stop infusions. Scrub the hub. Discard the initial blood. Collect your sample. Flush the line and document. That's it. You've just safely and effectively performed a blood draw from a PICC line. I really hope this tutorial was helpful for you. If it was, give this video a big thumbs up, hit that subscribe button, and share it with your fellow nurses and nursing students. Let me know in the comments what other nursing skills you'd like to see. As always, stay safe, stay skilled, and never stop learning. Thanks for watching, and I'll see you in the next video.